So before I hand it over to, we're going to introduce Jeff Coughlin. He's a Senior Director at the Federal and State Affairs of Himss North America. He's going to tell us why we're having this unique event. It's a little bit different than some of the other events that we have. Typically we have a panel or we have one speaker, and this is a special event, and we're really grateful to have Jeff here, and I'm going to let Jeff speak a little bit about that. Thank you all for being here, and welcome to Jeff.
Thanks very much. As Melissa said, I'm Jeff Coughlin, Senior Director of Federal and State Affairs at Himss North America. We're very happy to be collaborating with the New England chapter on this event, and happy that there's so many great people here. We're here to help celebrate National Health IT Week. Typically, National Health IT Week is an event that we try to bring people to Washington, D.C. and meet with their elected representatives in D.C., their senators and representatives and their staff. This year with the election, we decided to try to expand and make it a more of a state and local focus. So we have events, as you probably saw in the slides, that we're running during the cocktail hour in different parts of the country. So this is one of the events that we're trying to help sponsor and help promote and celebrate health IT. So this is it's a great week for health IT. Hopefully everyone has visited nationalhealthitweek.org. That's the website. I just wanted to mention a couple things really quickly in terms of I have some handouts up there with some of our the 4 points of engagement related to National Health IT Week. Those are about telehealth and about precision medicine and women in health IT and STEM careers, and also about interoperability across the spectrum of care. Those are our four big areas of focus this year. And you'll see more coming out from the Himss Government Relations Public Policy team as we get closer to the next administration and new Congress in January. So thanks again for having us here, and it's a real pleasure to work with you all, and looking forward to a good event. So thank you.
Thank you so much, Jeff. We really appreciate your support. Well, I'd like to introduce one of our speaker committee and longtime board members, Craig Schneider, and he will kick this off. Thanks, Craig.
Thanks, Melissa, and welcome everybody. We are delighted to have tonight's program, and as Melissa mentioned, it is different than what we normally do. Usually we'll have at these evening socials, if you've joined us in the past, we'll have a single speaker on some compelling topic, or we'll have a panel, or maybe a group of companies will get together and share their insights. But tonight we have actually two relatively unrelated, separate presentations, but I promise you the evening will hang together. So there are 5 themes for National HIT Week. And so tonight the reason we have 2 speakers coming at it from different angles is so that we could address 2 of those 5 themes. And although they're individual and they stand on their own, I think you'll see that there are some really interesting relationships between them. And of course, we think they're of great interest to the New England Himss community. So we'll be hearing about the topic of connected health, which is certainly hot and growing, and something that is, a little further on the horizon, but is starting to grow and get a lot of people's attention, which is precision medicine. And maybe in the Q&A we can explore how those 2 topics might be related and what might be coming down the road in the future. So we're going to hear from Robert Havasy, who's currently working actually within the Himss family as Vice President of the Personal Connected Health Alliance, and he's Executive Director of Continua, and formerly he was with Partners Healthcare System Connected Health. And he'll be talking about the value of health IT, expanding access to care via connected health. Then, after Rob's remarks, we'll have a relatively brief Q&A, and then we'll bring on Dr. Jeff Golden, who's the Chair of Pathology at Brigham and Women's Hospital, just down the street. And he's also the Ramsey Cotrain Professor at Harvard Medical School. And his talk will be on the value of health IT in innovating in precision medicine. Then we'll have a few more minutes for Q&A, and hopefully we'll have time. You can ask either speaker a question if you're interested. So please join me in welcoming Rob Havasy.
I think I'm Mike. Is it working? Pardon me if I borrow your tea. I promise not to switch it to the wine glass. Thank you all very much. I was telling a few people, a few old friends even that I haven't seen in a while, that I normally work from home. My home is in Grafton, Massachusetts. I haven't been around this many people in a long time. So I'm quite happy to be out in public again. Out of my, as I was saying to people, around 2 o'clock I realized I probably needed something better than a Reese's Peanut Butter Cup t-shirt that my daughter brought back from Hershey Park last summer. So I'm glad to be out among friends and colleagues again. As has been mentioned, I am Vice President of Personal Connected Health Alliance for 2 whole more weeks before I make a move to the Himss mothership organization, where I take over as the Senior Director for Connected Health. So one way or another, for about the last 10 years, Connected Health has been my career. So if you're sick and tired of me after tonight, no problem, I will go away. But if you want me back, since I'm part of Himss, I'm just a phone call away. Well, maybe? Do it the old-fashioned way. I'm going to walk a lot tonight, so my tracker is going to, there we go. A brief note about the Personal Connected Health Alliance and what we do, and then we're going to get into some fun stuff that I think relates to some of what Jeff was saying. He's blaming the fact that we're not doing National Health IT Week on, with the election year, Congress, in a session, out of session, a little funding resolution to take care of, so maybe not exactly the right time as people wonder what's going to happen. I'm going to talk about how government really doesn't work at all here in the United States, and it's not really helping us advance this connected health or even healthcare thing the way it is in other countries. Because the Personal Connected Health Alliance is a global organization. Thank you. And so I've been fortunate over the last few years to work with governments all around the world. And the one thing I bring back from my trips to Europe and to Asia and to other places is how far other countries are advancing and how quickly they are able to move once they make up their mind about a particular topic, and how important the backing of their governments are in making connected health work. But nonetheless, the Personal Connected Health Alliance was an amalgamation of 3 organizations that came together. Continua, the one that's near and dear to my heart, is a technical organization that puts forth a standards framework for connected health interoperability. Right? So based on standards that exist from other SDOs in the world, from organizations like IEEE to IHE to others, we have provided a roadmap, a framework for how you can take data in a standardized way on a device on your wrist and get it all the way through to a healthcare data repository using open standards. Right? And we feel that this is important both for data quality, but also to empower patients. Right? One of the core tenets of connected health is to allow patients to participate in their care. And standardized data helps make data portable, it helps make it trustworthy, it helps turn it into something that is not just a commodity that gets locked away in a database somewhere, but something that can be turned into information by a variety of parties. So the idea of a standards-based framework to make connected health work is certainly near and dear to my heart. We brought Continua together with the mHealth Summit, which is now called the Connected Health Conference. Somebody's going to be angry I didn't change the logo here, but my apologies. All under the umbrella of Himss. Right? So we found some like-minded people who understand health IT and the way that technology can really empower and move healthcare forward. Connected health is a relatively new term for some. Since I was at the Center for Connected Health 8-9 years ago, it's kind of an old hat to me. And surprisingly, for a number of companies, I'm finding it's also old hat to them. Companies are, some anyway, are moving beyond connected health now. And in fact, the precision medicine topic you're going to hear about is what seems to be on the tip of the tongue for many of the companies who've been around my organization for a decade. Right? 10 years ago, they thought connected health was the next great thing. Now precision medicine is where they're making their investments. So there is absolutely a complement between these two talks. But whatever you call it, what I'm really here to talk about is using some kind of technology outside of a traditional clinical environment to gather data and then help anybody who needs to know have a better understanding of a patient, a person, and their condition. Most importantly there, it's about connecting a patient to their data, to their health, to their clinicians, to their providers. Right? It's about empowering patients at their core and allowing people to know things about themselves. You know, on the right-hand side of this diagram, I mentioned that you can connect patients through their data to a variety of places. It doesn't always have to be a clinician, right? People do a tremendous amount of their own care in concert with family members, with peers, with other peer groups or like-minded communities. And connected health can be used. That's part of their overall healthcare. Connected health can certainly be used to make those connections happen and to make those connections have more power. When I look at the market, I see 4 things happening. And it took me a while to come up, make them all Asians, but I think I got it. Medicalization. Companies like Fitbit, as you see from the quote, making leap from products you talk about with your coworkers to those you talk about with your doctor. They're trying to become a medical device company. Is anybody from Fitbit in the room? I don't want to misspeak. Right? Nokia acquired Withings, one of the earliest digital scale companies, right? And Nokia has a long history in actually more than most people expect in diagnostics and other things. And aside from their cell phone business, which crashed, the reason they're still around is in large part due to some of the other technologies, the communications-enabled technologies in diagnostics and medical diagnostics and other things that they did. So you see companies that were pure consumer plays suddenly saying, ooh, we do have to pay attention to the doctors. This might not just be about showing somebody their weight and letting them tweet it and hope that they get better. There's probably something more to this. We see consolidation. We see all kinds of companies buying other companies. It started a few years ago, Intel bought Basis, but now you're seeing all kinds of things happening. Some of the early pioneers like Body Media and others have been gobbled up and acquired. Sunny Vu just sold Misfit wearables, right? Nike, some of the sports companies are getting into this. So we're seeing consolidation of the early pioneers in the consumer industry. And I think that's a good thing because it's giving those companies the chance at their second generation with resources and sales teams and engineering support, right? Beyond just what they had as startups. But in a way, we're seeing a bit of stagnation. We went through a period maybe 4 or 5 years ago where there was a new announcement about something new every week. There was a new tracker. There was a new way to put a case on your iPhone and hold it up to your chest and get a 2-lead EKG. There was a new way to, I don't know, put something on your belt and suddenly we were trying to, get full sleep patterns about you with your alarm clock. A lot of that has stopped. I could put up Gartner's sort of hype cycle here and they would tell us we're sort of in the bottom of the trough of disillusionment right now, so that's probably a natural progression of the market. You're seeing a lot of harebrained ideas start to shake out and you're finding companies beginning to understand where the money really is. And there is still money in medicine and people still trust other people in white coats and they trust their doctors and they trust their nurses. And so they're turning towards healthcare and saying, okay, now maybe we can realize that promise of connected health. And we're not going to ignore the healthcare system, as many companies thought they might. Their original business strategies were purely consumer. But now they're starting to say, okay, we need to be part of the whole ecosystem here. We need to be with a patient or a person when they're well and when they're sick. And if we can become a part of their life like that, then we really have a customer for life, and we can stay with them. We're seeing a little bit of simplification. And by that I mean, for a while, everybody thought you could monitor everything, and all you needed was a bigger and better dashboard, and just cram everything into it, every parameter you could possibly get, and suddenly, somebody would eventually draw an inference from there that would be helpful. The mobile revolution has really pushed for simplification now. And almost every app that I use, whether it's for my Xiaomi tracker because I'm cheap and I don't want to pay more than $40 for one because I ruined too many Fitbits smashing them on rocks and things, or whether it's the new Fitbit or whatever, the mobile revolution is driving this for people to finally understand, let's focus not on everything we can do, but on those things that really have impact and what should we do to drive decision making. Underlying all of this, though, is an important bit of infrastructure that is so often overlooked in the hype of the next greatest sensor, the next greatest thing. I was fortunate a few years ago, I was in Brussels and I had a chance to speak. They wanted a perspective from both sides of the Atlantic. And I spoke with a gentleman named Dr. George Crooks, who's the head of the Scottish Ambulance Service for the NHS. And he got up on stage in front of a bunch of entrepreneurs and he delivered one message about 10 times. And I'll never forget his quote in that great Scottish brogue. He said, none of my colleagues are looking for the next great sensor. for the love of God, if we could just deploy the stuff we've already had for 10 years more effectively, we would save millions of lives tomorrow, right? Just give me a blood pressure monitor, some better glucose monitoring, and a scale, and something to get people more active, and we'll save millions of lives. And that's still true today. And it's the enabling technology pieces that still are underdeveloped. There are still hundreds of sensors in the markets, at least a half a dozen scales you can buy and take home and connect to your Wi-Fi system. FDA just cleared Medtronic's artificial pancreas, actually, in the last 2 or 3 days, right? There's plenty of technology, wearable technology that you can bolt onto your belt. But if there's an endocrinologist in here who would tell me that, well, don't worry, whether it's a Medtronic artificial pancreas or something from Roche or something from J&J, don't worry, I have the perfect dashboard I need to help a patient really manage their disease, I would eat my phone, right? And that's where we're still seeing a gap. We're seeing a gap on this back end because the enabling technology is the important piece. And this is one of my lessons that I take away from around the world. Other countries seem to get this more than the United States does. Right? I threw this quote up here. It comes from 2006, so 10 years ago. But I think it's still as important as it ever was, right? The success of the internet is built on technological superiority, protocols and open standards that are ingenious in their simplicity, et cetera, right? The past few years have taught us that business models based on controlling consumers or content don't work, and that was back in 2006. And I think Google's done all right for itself in the last 10 years. I think I have $1 in my pocket. I'll give $1 to anybody who knows who this is. Oh, Jeff, that's not fair. You invited her last year. This is Minion Clyburn, which is why it's a public domain photo. She's one of the FCC commissioners. And at our Connected Health Summit last year, she said that infrastructure enables innovation. And I thought it was one of the most profound things I had ever heard. Right? This was all in the middle of the battle about net neutrality and all the other things that were happening at the FCC. But she said this, infrastructure enables innovation. And she was absolutely right. In order for connected health to work, in order for this thing I'm wearing, in order for my artificial pancreas to really provide utility, this data has to go to the places it needs to get to in order to be turned into the information that makes my life better. In my opinion, interoperability is fundamental to that. It doesn't matter if, and people seem to like this term, right? I talk about the Roach Motel data model, right? Where data checks in and it never checks out again. Right? You can have the greatest analytics platform in the world this month. It probably will not be the greatest analytics platform in the world 2 years from now. So as a user, as a patient, as a person who's concerned about my healthcare, my data needs to be portable. And interoperability is fundamental to that portability. Interoperability is also important because people use technology that's easy, right? Wi-Fi may have its issues, but why is Wi-Fi ubiquitous? Because everybody by this point has figured out how to put what devices onto a Wi-Fi network. And you may not like your web key, or if you're still using it, or you may not remember your WPA password, but at least most people can figure that out. It's pretty interoperable. The Withing scale you bring home, or the laptop that you bring home, or something else, you know there's a key, you put it into something that says something about the Wi-Fi network, and it just works. Other systems haven't quite gotten there yet, and there's the interoperability about how the user interfaces work, but more importantly about where that data can go afterwards. And so this whole thing, this whole concept of connected health, this whole idea that I'm going to collect some information about myself and turn it into something that makes my life better only works if that data can go somewhere. And this is where I start to take lessons from my European friends. And I'll talk a little bit in a couple minutes about what I think they're doing differently and why I think they're leaping ahead of where we are in the US right now. And maybe a couple things we can do about it. But this comes from back in 2012, and this one comes back in 2014, right? Scandinavia right now is leaping ahead in great strides, right? Denmark adopted an interoperability framework for telemedicine in 2012. Norway followed in 2014, and I could list the rest of the countries. Scandinavia certainly followed. Sweden's working on it right now. Other regions in Europe, Catalonia in Spain, is moving ahead. they've all begun not with an innovation economy, not with innovation hubs, not with Seaport District innovation centers, with real hard infrastructure. We're going to build a national system and it will be interoperable. Because they believe this, that if they have an interoperable infrastructure, they can leapfrog the rest of the world because it can enable their innovation. Because no one has to reinvent the wheel, no one has to invent a new data protocol, no one has to invent a new JSON structure to put blood glucose data into a database if we just all agree that there's probably one out there that we could all use. And a few other things happen in other countries as well. They have a tradition of sort of social care, right? They have a belief that healthcare is a right, a fundamental right of citizens, if not a fundamental human right. And therefore, healthcare systems should be designed thoughtfully and for the greatest common good. And they know, since interoperability is on my mind and close to my heart, right, that standardization does many important things for them. It enables data mobility, so their citizens can move where they want to move, and they can buy what they want to buy, and they can use what they want to use, and they can connect it to the network. That it reduces disparities, because once you start to get economies of scale, because everything can connect to everything pretty easily, you can distribute more equipment to more people where it needs to be. And on and on and on. It reduces complexity, it reduces costs, etc. So if I look to those nations that are having success right now, that have adopted national architectures, that have moved beyond pilots, right? Norway is now beyond the first 10,000 citizens connected to their system, all on their way to as many of the 5 million people as they can get. What's really driving this? Well, political boldness. I was in a meeting in Paris a couple of years ago, and there were some Scandinavian countries in the room, along with the French government officials from the Ministry of Health. And I'll never forget it, because they were arguing in English, which was even funnier. When the French government said, well, this will never work here. Your citizens trust your government. We could never build this. And I think that's true, right? There's a bit of political boldness and trust in government. The citizens say, go ahead, spend some money, build a system. If it's not exactly perfect, well, we'll tweak it. I don't want to minimize the fact, though, that when we look at a country like Norway, that having a lot of money helps, right? The North Sea has been very kind to the Norwegians. They have a sovereign wealth fund worth a few $1 billion, and they have 5 million citizens. So they can take a chance. They can spend $100 million, and if it all goes wrong, hopefully with some decent investments, they'll just make that money back in a few years. But nonetheless, there are other countries who are figuring out how to do this without having all of these in place. The shared social responsibility, a cooperative industry, good connectivity, good telecommunications, all those things are important. And this is where we get to the point of saying, do we have this in the United States? I don't know. Do we have a bold Congress right now, willing to take risks and a lot of trust in government? So I get very discouraged when I see this, right? Maybe we'll just rip and replace Obamacare. So I'm not sure we all have a shared social responsibility idea either. But there are at least the same drivers. If I take away the political layer of this and I look and say, why is Denmark, why is Norway, why is Singapore, why are these countries doing these things? Why are they doing these things? Because they're facing the same problems we have, right? Their populations are aging, healthcare costs are increasing because the Western diet and sedentary lifestyles are becoming ubiquitous, and there's in most cases some sort of unequal distribution of population. If you look at China, for instance, right, it's become very urban very fast, and suddenly the hospitals in cities just can't handle the volume of people they have, so they have to do something to treat them outside of the walls because they can't build hospitals fast enough. Denmark said the same thing. Why did they embark on a national telemedicine program? Why are they embracing connected health? Because they can't build enough hospitals. And they know that with a demographic bubble, a baby boom bubble, even if they could build enough hospitals, they'd have a bunch of empty ones 20 or 30 or 40 or 50 years from now that they don't need. So at least I can look and say, well, these should ring true. Most of you can think of the way these are affecting the United States. So if we have the same drivers, even if we don't necessarily have the same political layer, maybe, just maybe, we can come up with our own solutions to do this. And I think the time is right. I think we are at the bottom of that trough of disillusionment. We're about to climb up into that part of the curve that says now we can get the real work done. And so I found this quote, and I like it a lot, right? This is an infrastructure problem. Right now in the United States, connected health has an infrastructure problem. We have broadband disparities. We have providers in rural areas saying they don't have good enough connectivity so that even if their patients had access to connected health, they're not sure that they would be well enough connected to really use it. We have a lack of interoperability. We have data blocking left and right. We have Congress getting angry and activists. And we have a whole host of other problems. Analytics are part of that infrastructure, right? I said on a panel here in Boston, actually, at Suffolk University about 6 years ago. 6 years ago, we were already collecting more data about patients at home than we could possibly analyze and turn into real medical information. And that problem has only gotten worse as sensors have proliferated, as everybody wants to connect their fitness band to their doctor. Everybody wants to send in 365 weights when they step on the scale every morning, right? Nobody can triage this data fast enough. And it's not just that we don't have the platforms to analyze it. That's not the problem, right? We can analyze big data sets. The clinical rules don't exist yet. Is the blood pressure cuff you send home with a patient equivalent to the readings you take in the office? Can you treat and prescribe the same way? Well, the American Heart Association took a crack at it, but I'm not sure all the comparative effectiveness has been done. So there's a lot of work to be done, not just in analytics power, but in how we utilize this information. And this is all part of the infrastructure gap that we have. We certainly need better infrastructure. We probably need a more cooperative climate to get there, right? I mean, this article came out, Slate just republished it. It actually came out earlier this year. Why do doctors still use pagers? Well, because they work. Right? They do what they need to do. They reach into the bowels of that old big granite building at MGH into the basement, and they get there better than a cell phone signal. You don't have to plug it in every 3 hours. We need connected health to reach this kind of level of infrastructure. It needs to just work. We need the analytics power, we need the connectivity, we need all of the stuff that happens behind the scenes, right? Oh, doesn't want to go backwards. I can only go forwards, right? Long before Ali gets out into the ring, somebody needs to build this stuff. Well, it doesn't want to go either way. Now we're stuck on this line. I killed it. All right, interesting. Let's see if we can.
It only happens to technology experts.
I can't even hit the, when the escape key doesn't work, my help desk, that's it. That's the extent of my help desk talent.